Welcome, everyone, once again to our foundation, the Reality You and You Foundation. We have with us an esteemed speaker, Dave Carnival. He is a clinical psychologist who specially addresses issues related to anxiety. We will hear from him today a lot of information on phobias, obsessive compulsive disorders, panic disorders, and generalized anxiety disorders. Sir, thank you for being with us. You have been extremely experienced. You've given training to 10,000 or more psychologists. You have 4 published books. I went through your website and we have very, very interesting techniques that I would like to talk about through our session. Thank you for being with us.
Yeah, thank you for inviting me. I'm glad to be here.
So we wanted to reach out to you because we have been seeing the cases of anxiety, especially panic disorders, stress, where people do get panic attacks. I just had somebody in my clinic who said, I had a panic attack and I broke down and I felt numbness and I froze. So we've seen through COVID and after COVID, maybe work pressures have increased. People are catching up with life and relationships. What has been your experience?
Well, here in the United States, it's a little paradoxical. It's not what you might expect immediately. People with chronic panic disorder, when the pandemic came along and we were told stay home, don't go to the office, stay out of stores, stay off of airplanes. I think for the most part, people with panic disorder were kind of relieved because they had a new justification for staying home, that they were afraid to do those things anyway. And now everybody was afraid to do them. So they felt like they were more in the general mainstream of the population. What happened as COVID receded, people who felt like, gee, I got a temporary reprieve the last couple of years, I could stay home. Now their reason for staying home was gone, and they felt quite stressed about re-entering society. I think that was that group of people who had previously had panic and felt relieved. They're probably the ones who suffered the most here when COVID ended.
So can we just start for the audience, because we are trying to create a lot of awareness. So when we are talking about a panic disorder, in very simple terms, how would you describe them?
Well, a panic disorder is a condition in which a person experiences recurrent panic attacks over time. It'll start with one panic attack, which typically comes unexpected, suddenly, seemingly out of nowhere. An ordinary day, they're not doing anything unusual. They start having a lot of strong sensations of physical fear. Their heart seems to be working faster and harder. They have trouble catching their breath. They feel numb and tingly in their fingers and toes and scalp. They may have digestive distress. Their stomach doesn't feel right. Their chest hurts, feels tight, a whole blizzard of powerful physical sensations. And they're really afraid, and they know they're afraid. And they look around to see, what am I afraid of? And they can't find anything. There's nothing dangerous outside there. It's an ordinary situation. They're terribly afraid. They don't see what they're afraid of. Well, we don't like that. We expect to know what we're afraid of.
Yeah.
So if they look out and see, I don't see what I'm afraid of out there, their guess is going to be, there must be something terribly dangerous happening inside me.
Right.
Maybe I'm about to die. Maybe I'm about to faint. Maybe I'm about to go insane. Something terrible is happening. And they get terribly afraid, probably flee the scene. One way or another, the panic attack ends. But then the phase begins where they anticipate having a panic attack. They limit their activities. The next time they go to the place where they had the first panic attack, they're liable to have another. If they go to a place that resembles that one, they're liable to have another. And so then they find themselves in this really difficult situation of recurrent panic attacks and developing phobias.
So I've seen a lot of
That's panic disorder.
I've seen a lot of patients, not accepting their panic disorder. So, like you said, it's a sudden physical anxiety that comes in. But a lot of people find it very difficult. Like you said, there is no, threat in the environment, and you can still have a panic attack. So, what could be the potential triggers, and how does one understand and accept that, yes, this is a panic attack?
Well, the trigger the trigger there is no known trigger for the first panic attack. That one just arises on its own. It typically comes when people are in their 20s or early 30s, and that seems to mean it occurs to people as they're moving up to the front ranks of independent adulthood in the States. It's when people are graduating college and
Right.
getting married and getting their first home and so on. Lots of changes. Might be all good things, but maybe more change than they can comfortably manage. And then they have this first panic attack. After that, the triggers for subsequent attacks are anything that reminds them of the first panic attack, any situation from which they can't leave as quickly and visibly as they might wish. So sitting in a line of traffic that's not moving might be a cue for a panic attack. Sitting in a movie theater and you're in the middle of the aisle and there's people on both sides of you might be a cue for a panic attack. Standing in line at a grocery store and then the line is moving slowly and then the cash register breaks down and now you're stuck and you can't leave. Anything from where you can't leave as quickly and invisibly as you might like. Even sitting down to have a restaurant meal with friends might seem like what people call a trap, meaning I can't get out of here right away. So those are the typical scenarios that will induce a panic attack.
And how would you differentiate a panic attack from a normal anxiety that, day-to-day stress, because stress is
Well,
such a term that is used so loosely. How would one then differentiate and go to a therapist? Because often I see clients very, hesitant to seek help.
yes. Well, the panic attack is differentiated from run-of-the-mill anxiety, if you will, by the fact that the symptoms come on very suddenly, very rapidly. They peak very high. The severity of the symptoms is much greater than with ordinary day-to-day anxiety. They peak really fast, and typically, although the individual tends to forget about this, then they diminish rapidly as well.
Okay.
Whereas someone with generalized anxiety disorder, which is a more daily pattern of high level of anxiety, it goes up somewhat and it stays there for long periods of time, whereas a panic attack peaks and passes. A panic attack seems like an emergency, and generalized anxiety just seems like I never quite calm down.
And after COVID, would you say that people have become very anxious about their health? So, any kind of a panic attack, they would go to an emergency in a hospital because they are anticipating it to be a heart attack?
Yes. Now that, at least here in the States, that hasn't really changed. People were going to the emergency room with panic attacks, for years and years before COVID.
Right.
Um, Particularly the first couple of times they had a panic attack when it was new and unfamiliar to them. And they would go there and oh, it's a terrible experience going to the ER with a panic attack. They would sit there for a long time and wait. They never got very much good help at the emergency room because a panic attack isn't really an emergency,
Right.
at least not the kind of emergency that the ER is there for. And the person having the panic attack was so frightened. They didn't understand that. They didn't realize why it was so unhelpful. Lots of times, by the time they got to see a doctor, the panic attack was already over.
Right.
So it's rarely a good experience going to the ER with a panic attack. It's not the right place to get help.
And are there any life factors that we can associate with these anxiety symptoms or panic attacks? Is it your diet? Is it your sleep? Is it your exercise? Is it your loneliness?
I don't think it's that focused. What seems to be most important is stage of life. That when you're in your 20s or 30s, almost that's when people have their first panic attack. I rarely see anybody older than 40 having a first panic attack. It happens when they're stepping out into the world and becoming independent adults. Um, Gee, I had another thought there that I wanted to say. What was it? But that's the principal thing that sets it apart. That time in life, it's like that's when panic disorder blooms. Every flower blooms at a certain season,
Right.
and that's the season for panic disorder in your 20s and 30s.
So is it also because that is the most essential phase where we go and seek out work and relationships? There's a huge amount of rejection, judgment. People are fearing how they're being perceived, or how, right now we see in the new startup era, especially in India, we see the young adults, especially in their 20s, they want to make it big very fast. So there's an
Sure.
immense pressure to perform. So could those be potential triggers of how you're thinking about life and how you're going about it?
Yes, absolutely. I think much more important than anything else, that's when you're trying to land. That's when you're trying to prove yourself. That's when you feel like I got to catch this next boat before it leaves the harbor. And even it isn't necessary that the person experience disappointment or rejection during that time. Even people who are quite successful, that they succeed at everything they go for, they're still very likely to have panic attacks because they feel so pressured internally. It doesn't matter how successful they are. In their mind, um, everything is at risk, and they have to keep struggling to hold it together.
So they have to keep maintaining the standard of success that they've achieved.
Yes, yes. And so the more they achieve, the more anxious they feel. It's
Right.
like the difference between, if you have a dog with one bone, well, a dog with one bone can enjoy it. A dog with 20 bones is too busy looking to see how can he protect all those bones.
Right.
And he doesn't enjoy any of them.
So in terms of coping mechanisms, what can a person do, until he reaches a therapist, until he gets an appointment with a clinical psychologist, how do they handle their panic attacks? If you don't go to an ER, if you don't get an appointment with a therapist, what can you do, like a home-based strategy?
Well, that's difficult. They'll probably still go to the ER because unless they've had reason to learn something about panic attacks before they have the first one, when they have it, they're not going to think it's a panic attack. They might not even know the term. They're going to think it's a heart attack. They're going to think something physically is wrong with them. So they probably will have to go and, see a physician, see the ER, get disappointed, find out that they're told, well, it's nothing serious, blah, blah, blah. They're going to have to work through that and in some way be led to educate themselves about panic. If they could do that ahead of time, maybe because they had a relative,
Yeah.
somebody else in the family who has panic, and so they had reason to learn about it, that would be good. But that's really the first productive step. Once they realize it's panic, educate yourself about what's good to do when you're having a panic attack and what's not good to do when you're having a panic attack. That would be the first step.
So can you give us some tips on, what are the tips that what are good things that we can do during a panic attack or after a panic attack?
Yes, absolutely. And on my website, I have an article about the what's called the aware steps. This is how to walk your way through a panic attack. It's an acronym, AWARE, And the first step is the most important one. It stands for acknowledge and accept. So here you are, you're having a panic attack, you're having trouble with your breathing, your heart is doing stuff, you're really, really afraid. If you can summon the recall and the willingness to go to that acknowledge and accept step, it would look like this. Well, oh my God, I'm having a panic attack and I'm really afraid. Don't like it, don't want it, don't deserve it. I'd like to run the heck out of here and just fight this thing off. But you know what? If this is what I have to experience now, okay, I'll wait this one out. I'm going to give myself a few minutes and let it settle down. I'd rather be feeling something else. I'd rather be somewhere else.
Yep.
But I'm not gonna try and fight it off. I'm not gonna try and pretend it's not happening. I'm not gonna deny it. I'm not gonna try and distract myself. I'm not gonna drink a lot of alcohol to try and get rid of this thing. Don't like it, don't want it, don't deserve it. But if I have to feel afraid now, okay, I'll wait it out. That would be the first step. And it's really, when you boil it down, that's kind of the opposite of what most people's are going to do instinctively. They're going to deny it's happening. They're going to think it's a calamity. They're going to flee the scene. They're going to try and distract. They're going to do all these things that they hope will help, but actually make it worse. The more you try and fight this, the more it makes it worse.
And so can you go through the acronym with us? So what?
Yes.
Yeah.
So that's acknowledge and accept. The W stands for wait and watch. And wait in the sense of don't just do something, stand there. This is not an emergency. There's no fire to put out. I don't have to rush. I'm all freaked out and anxious, but I'm not facing an emergency. So let me stay in place and work it through and watch what? Watch my symptoms, watch what I'm doing. The ideal form of watch is to fill out a panic journal. And there's a questionnaire on my website, and a lot of people have versions of it. I have a little questionnaire I ask people to fill out when they're having a panic attack. It's the questions I would ask if I were there.
Right.
Can you rate your panic on a 0 to 10 scale? What were you thinking just before the panic attack started? What are you afraid is going to happen now? Are you breathing? What are you doing with your breathing? It's going to direct them to notice some things and respond while they stay and wait for the panic to diminish.
Right.
That's wait and watch. And now we come to the middle A of the word, which stands for action, to take some action. And we deliberately put that in the middle of the word because most people's instinct will be to jump into action immediately at the top.
Right.
And if you go into action immediately at the top, you'll probably act in ways that are unhelpful. You'll probably run away. You'll probably struggle. You'll do all kinds of anti-anxiety things, which seem to make sense, but actually just make it worse.
Right.
That with a panic attack, people literally get tricked in the manner of putting out fires with gasoline.
Right.
And gee, the fire keeps getting hotter. What's wrong? Well, it's because you're using the wrong method. You're struggling, you're resisting. So that's the time, perhaps. Okay, is there some action I can take to help myself deal with this a little better? And then I'll come back to that in a moment. The R stands for repeat, partly because, well, we just needed an R to make the word work. And also R is there to remind you, you might start to feel a little better. Okay, I'm settling down, that's good. And then, whoa, here comes another big wave of panic. And if you didn't have repeat there, you might think, it doesn't work, I got to run away.
Right.
But no, repeat is there to remind you that's okay, that might happen, just take it from the top again. Just go through the steps a few times. And E is there to remind people that the panic attack is going to end. Because their mind is probably filled with thoughts about
Right. Yeah.
what if it doesn't end? How can I make it end? What if it doesn't end? What, even though every panic attack ends, no matter what you do. So E is there to remind you about end. So the action to take in that middle step, well, if you can see that you're all terrified, but not in any danger, well, then there's nothing of vital importance that you have to do, that the actions can be fairly benign. It's useful to have a nice breathing technique to help you in that action stage if you find that your breath has gotten short and shallow and labored. That's probably the most important thing to remember, that here I'm going to wait it out. I'm going to breathe a little bit. This is the time to remember, what is my job when I'm having a panic attack? And people initially think their job is to bring the panic attack to an end, to save themselves somehow. So I want those people to look at their history with panic attacks and answer this question: have you ever had a panic attack that didn't end? And the answer is going to be no. No, they never had one that didn't end. And what they can see generally is they look at their history, that when they responded in the best ways possible, the panic attack ended. When they responded in the most unhelpful ways possible, when they got fooled into fighting and resisting and running away, those panic attacks ended too. Every panic attack ends no matter what you do. There isn't anything important you have to do other than acknowledge and accept and wait and watch. And so if you're willing to just hang out there and wait for it to end, that's all you need. And if you need to breathe a little more comfortably, then that's a good thing to do. But no life-saving action is required, because panic is scaring you, but it's not threatening you.
And I just wanted to know that, during this time of action, would it be appropriate for somebody to call in for like support? Call in a friend, call in a relative, call in a co-worker at work, for kids in school, should they approach a caretaker there? Would that also classify as action?
Yes, I think if we think about adults first, it would be fine, probably helpful to be able to speak with a trusted support person.
Right.
Just a couple of notes about that. Sometimes people will call their friends, not to tell them that they're having a panic attack, not to ask for support, just to chat on the phone and try and distract themselves.
Right.
That's not a helpful thing. I would encourage people to, call someone who can be supportive, who already knows that you have trouble with panic. Hi, do you have a minute or so to talk to me? I'm having another one of those panic attacks. Get right to the point. Don't try and disguise it or hide it, or use somebody to distract you. Call someone that you can speak to about the panic attack. And second, then, is recognize you're calling for support, not rescue. You don't
Yeah.
need to be rescued. The panic attack will come and go. You can talk to this person for support while you're waiting for it to go, but you're not calling them because you need them to rescue you. You're not in need of rescue. You're not in danger. You're just terribly, terribly frightened and upset, and that's what you need support with. With respect to children, well, the younger we go, the more they may need more active intervention. Children don't need just support. They need to feel like they're protected. So the younger we go, the stronger the intervention needs to be. But for an adult, I would hope that they would always call somebody who knows about the panic, and they can talk about the fact that I'm having the panic attack. Give me a few minutes of your time and talk about it on the phone. You don't need to come and pick me up. You don't need to take me to the hospital. I just need to be able to talk my way through this for a few minutes.
So even with friends and family, would you recommend caretakers and people who are being supportive at work, should they also follow the aware technique? Like you said, the acceptance, because they may also, the anxiety may pass on to them because they are unsure about what's happening as well.
Yeah, well, those folks hopefully will also have an opportunity to educate themselves about panic attacks, because, yeah, it could be very scary. Your friend calls you and they're very agitated and upset and afraid that they're going to die. Maybe you think, gosh, maybe they are dying. So that would make it hard to be helpful
Right.
appropriately. So yes, the support people in particular, very beneficial for them to read some of the same resources to learn about panic so that they can do a better job of being helpful. If they don't know about it, then they're more likely to want to try and take control of the situation and rescue them. And that's not what a person with a panic attack needs.
So in the modern positive psychology, when we talk about prevention, is there any self-care plan that needs to be formulated for the youth, where, they can prevent further panic attacks?
Um, it's probably not so much about preventing panic attacks. I like to think of it more as uh, doing a better job of educating youth about their bodies, about their emotions, even about their breathing.
Mm,
There are things about, how your breathing works that kids don't tend to learn in school. And
yep.
then all of a sudden at 20, they're struggling to gasp and they don't know how to breathe in a calm manner. It would be really nice if they could learn that, in first grade. It would be really nice if they could learn that we should all expect as part of life to at least occasionally have some very upsetting thoughts, to be seized by powerful emotions, to recognize that emotions can make physical changes in our body. That when I feel my heart racing, it doesn't necessarily mean a heart attack. It means in some way that I'm very excited, either positively or negatively, and that's normal and ordinary. Our bodies aren't separate from our emotions. So I think if children had the opportunity to be better consumers of mental health information like that they would be better prepared uh, for those times when they do experience panic symptoms.
I think that's right. And doctor, you have mentioned something about talking to your amygdala, on your website. So, and a concept called worry appointments. Can you sort of take us through what is worry appointments?
Yes. So people with panic disorder and people with other anxiety disorders as well experience lots of worrisome thoughts, nervous anticipatory thoughts.
Yep.
Um, and they tend to take those thoughts seriously. Uh, they tend to experience these worries in the middle of their busy day while they're doing two or three things at once, while it's in the back of their mind, while they're multitasking. And these anticipatory thoughts generally take the form of, I'm going to diagram the sentence here. There's a what if part at the beginning of the sentence. And then there's what I call the catastrophe clause after that. And these thoughts are all taking the form of what if ship sinks? What if building burns? What if airplane crashes? What if something terrible? Uh, and even more importantly than that, it's literally what if something terrible
Happens
that
to.
isn't actually happening now? So I want people to realize what's the most important part of the sentence. It's not the catastrophe clause. You can put anything in there. The
Right.
first part of the sentence is what's important, that what if. And I'm going to ask people, well, what does the what if mean? What's another way of expressing what if? And I think what it means is you're getting the thought that says, here, this catastrophe clause, here's something terrible that isn't happening now. And why don't you pretend that it is? And people take the bait and then they picture the catastrophe and then they think how badly they will feel when it happens and they anticipate being blamed for it and people shaming them and
Yeah.
shunning them and they experience this terrible scary movie in their mind and nothing's actually happening. It's all a picture in their head because they didn't notice the what if part. They just got the telegram part about something awful. Worry appointments are when you set aside typically 2 10-minute periods each day and you reserve as best you can your worry for that time. And I ask people to look into a mirror when they're doing this. So you need some privacy, some quiet. Look into a mirror, do your worrying out loud, fill that 10 minutes just with what if this bad thing and what if that bad thing. No problem solving, no reassuring, no comforting yourself. Fill that 10 minutes with worry. A peculiar thing to do, no doubt. But here's the advantage. Here's the potential benefit. As you get into the habit of faithfully showing up for your worry appointments each day, it tends to give people considerable postponing power the rest of the day. That as you find yourself, oh, I'm starting to worry about that thing, about what happens if I get on the highway, what happens if I go and get into that crowded store, and then they can stop and consider, can this wait until my next worry appointment, or should I do 10 minutes right now? It gives them a better choice to make, so that they're not in the position of having this worry nagging at them all day long. That's what
So
worry
you sort of
appointments is about.
park your worries until a time that is allocated for the worry.
Yes, yes. Or sometimes, if it seems like this is so compelling, this is so difficult, I don't think I can park it until the next appointment. Okay, then let's have an additional appointment right now. All right, if I have to. So that's the choice. Either wait until the appointed time, that's preferable, or if you really don't feel like you can do that, go do an extra appointment right now. But stay out of that middle ground where it just keeps nagging at you as you go on about your business.
And when you say talking to your amygdala, is that the scary movie that you were talking about?
Yes. What I really think of it as retraining my
Yes,
amygdala.
yes,
My amygdala, well, the amygdala is the part of the brain that's most responsible for fight or flight responses. And for most of us, our amygdala isn't terribly accurate. It's biased in the direction of seeing threats that most of us have an amygdala that would rather see 10 lions that aren't there rather than miss the one that is. So it's biased in the direction of seeing threats that aren't there, because that's how it keeps us safe.
right.
The amygdala is not about making us smart, it's just about keeping us safe. And it overdoes it for most people. So if you have an amygdala that kind of overdoes it in that way, that sees 10 lions when there aren't any, well, that's an amygdala that needs retraining. That's like having a watchdog that does deter the burglars, but it also barks at the squirrels and the leaves blowing across the lawn and the children. No, that watchdog needs retraining. Your amygdala needs retraining. And the way we retrain the amygdala with respect to panic is what psychologists generally describe as exposure treatment.
Yeah.
I'm going to go and practice with that which gets me afraid, and I'm going to hang out with the fears, and I'm going to stay there in place and do the aware steps, and I'm going to go and hang out with that and allow the fear to subside.
And I think on your website, I was reading about, the concept of floating.
Yes.
Yeah.
Floating, this is something, from Claire Weeks, gosh, 50, 60, 70 years ago, the first person on the planet to write in a really helpful and useful way about anxiety. People still love her writing today, still reprinted after all these years. And that was her notion: float with the panic, float with the anxiety. I think people often were a little unclear. Well, exactly what does she mean by float? I think she meant the opposite of swim. Make no effort, simply allow the environment to support you. That's all you have to do. It's scary. You have all kinds of exaggerated ideas and urges flashing through your mind. But the truth is, you just need to float with it and hang out with it and give it time to subside. And then the more you try and swim and paddle your way through it and exert yourself, the more agitated you come to feel. That's what she was talking about with float. Just allow it to happen and allow it to pass.
So in terms of, so you're saying during the panic attack, just be in a floating state. However, then we can start, how you said, accepting it, waiting and watching it, and then taking the action.
Well, yeah, I think of the aware steps as an operational way of defining what floating means. That
Okay.
if you go through those steps, you're doing what Claire Weeks intended. To simply tell people float, sometimes they need more help, more details than that. Well, but I'm not in water. What should I do? It's a little vague.
Yeah.
But I think if you do the aware steps, you're fulfilling the promise of what she described as float.
Floating. And when you
It's about offer no resistance is a key part of floating.
And when we are talking about exposure therapy, obviously we are taking an action towards something that we fear. Uh, and that itself is very overwhelming to some clients.
Yes.
So how can, therapists at large, or how can even friends and relatives sort of help through the exposure? Do you think it's safe to do it at home?
Well, by definition, exposure is always safe. We don't do exposure to lions. Uh, we don't do exposure to murderers.
Right.
We're doing exposure to anxiety.
Yeah.
So I think it's always safe. Maybe more. Will it be productive? Will it be effective?
Right.
Um, uh, so there are some things that will help it be effective or not. Uh, uh, in order to do exposure, well, the client, the individual has to decide for themselves, how much exposure am I going to do today? Do I, if it's somebody that has trouble leaving their home, will I walk to the end of the street? Will I walk 2 blocks? Will I walk, a quarter of a mile? The individual has to decide that for themselves. No one should impose that on them. Because if they don't choose it for themselves, they're naturally going to want to resist it. So they have to be in charge of those decisions. Nobody should make them do anything. And so if they're doing exposure at home with the help of relatives, friends, support people, those support people need to take a back seat and basically be in the position of saying, I'm here to be of support to you. I want to help you. I'm not going to make any decisions for you. I'm not going to compel you to do anything. I'm not going to rescue you. I am here to provide support. If there's something you want me to do, if you ask me, I'll probably do it, but I'm not going to tell you what to do
Right.
because it's important that the individual develop that themselves. If somebody's telling them what to do, if somebody's making them do something, that's not really exposure. That's not going to be helpful.
And in the times of these, do we also feel that people need to set boundaries, have certain limitations, have better communication skills in order to express, what they're going through?
Yes, one thing, in terms of boundaries, I find people with panic in general seem to have more trouble saying no
Yeah.
than a lot of other people. And I think sometimes, well, would you like to come to the movie theater with us? Uh, if they don't feel they can say no, then they feel trapped and they start to panic. If they could be better at saying, thank you for the invitation, that's probably more than I feel able to handle now. They need better ways to say no and express that. If you can't say no, then you always have to say yes.
Right.
And that scares them, then that leads them to feel trapped. So that would certainly be an important communication skill. This I'm willing to do, that I'm not willing to do. The ability to say no and set those limits.
So is it also because they want to please others and they are sort of people pleasing and validating people because
Um,
they are not confident within themselves?
yeah, it's probably partly people pleasing. It's probably also, some anticipatory worry that
Yep.
that the other person isn't going to allow me to say no.
Mm.
That they're going to say, that's terrible. You know, you have to do this. That they're going to get an argument, that other people won't respect their boundaries. That, you know, it's some of it's pleasing, some of it is just fear that they won't respect my boundaries.
Okay. And I would want you to talk about the worry trick. You also have a book on the anxiety trick. And when we're talking about a trick, how are these tricks helpful?
Well, the trick is basically this, and this, you know, there's versions of this with panic, and there's versions of this with worry. But the trick is basically, I'm feeling powerful discomfort, maybe physical discomfort, maybe intellectual discomfort with these scary what if thoughts. I'm feeling terrible discomfort. I'm getting tricked into treating that like danger, that I have to fight off the discomfort, that I have to run away from the discomfort, that I treat that anxiety and panic like an enemy.
Mm.
And so that's what leads people to try and fight it off or to run away. That's all we have for enemies. We fight them, we run away from them. That's all we got. Panic and worry isn't an enemy, it's a discomfort. And people get tricked into treating it like an enemy. And the problem with that, the main problem with that is that when you do try and fight your anxiety, when you do try and run away from your anxiety, well, if you were up against a predator or a mugger, fighting, running away would be useful, would be likely to be helpful. When you're up against anxiety, fighting, running away from it tends to increase the anxiety rather than reduce it. And so the more people fight and resist, the more they end up with this terrible situation where they realize the harder I try, the worse it gets.
Yeah.
And they think they're doomed. They think they're ineffective. They don't recognize in the moment, well, the harder I try, the worse it gets. That's because I'm trying things that do make it worse. I should try very different things, opposite things. Instead of running away, I should join it.
Yeah.
Instead of fighting it, I should play with it. I should do the opposite of those things.
And
That's what the trick is about.
and your book on outsmart your anxious brain. And I think, we are living in a very uncertain world. After the pandemic, we've seen major wars, we've seen people losing jobs this year, so we've seen very uncertain conditions in the world. And I think anxiety is to, some part of anxiety is also wanting to control things around. So how does one sort of, outsmart yourself? If your brain is totally living in anxiety, how do you outsmart it and sort of gain a control over it?
Well, that's a tricky bit. You're wanting control, trying to, it matters. What am I trying to control? Control is about what we do with our hands and our feet and our mouth. We can control our actions. People who are struggling with anxiety get into this situation where they try and control their thoughts.
Yeah.
They try and control their emotions. They try and control their physical sensations. None of that works. If I were to say to you now, well, gee, for the next 30 seconds, I'd like you not to think about the solar eclipse. Well, you'd probably fail.
Right.
Anytime you tell yourself, don't think this, think that, you're going to get the opposite of what you wanted. Anytime you tell yourself, you tell a friend, calm down. Has anybody ever calmed down because somebody told them to? I don't think so. And it doesn't work any better if you tell yourself to calm down than if you tell somebody else to calm down. So, of course, there's that urge to have control, but we need to bear in mind, I can't control my thoughts. I can't control my emotions. I can't control my physical sensations for the most part. What I do control, the only thing I can control is what I do. And that's what I want to focus on. That's what I want to hold myself accountable for. My thoughts, my emotions, my sensations, I need to work with them rather than try and control them. Because the more I try and control them, well, it's like talking to a 2-year-old. You tell a 2-year-old, don't sit there. Well, the kid's going to go over and sit there. And that's how your emotions will respond to being ordered around.
And I think this is very difficult for many people and most people to accept, is that, their own thoughts and their emotions are not under their control.
Yes. Yeah,
And they,
if not for that, if it weren't for that, panic attacks would be easy to deal with. They just dismiss it.
right.
That's what makes these such difficult issues. People naturally, instinctively want to control it.
Yeah.
And that's the worst thing you can do.
Yeah. My last question is, of course, we've discussed a lot of tips. We've looked at the aware mechanism. We've spoken about floating and making worry appointments. There's a lot of literature on your website for us, for the audience as well. I just want to touch base on the concept of medication for anxiety and panic. Uh, you know, uh, when would you recommend somebody to sort of seek the help of medication?
Okay. In the United States, medication is terribly overused.
Yeah.
For the most part, I think medication for panic, for worry, um, uh, that should be regarded as something to try later in the process if the therapy, if the exposure, if the cognitive behavioral work doesn't produce the results a person wanted.
Right.
I don't think medication is a good first choice treatment. I think it ought to be the last choice treatment, because most people can do much better with learning how to handle differently their thoughts and emotions and sensations. One big problem with the medication is it's going to appear to people as though it's something that's rescuing them,
Yeah.
that it protects them. And when we're doing exposure, we want to weed out all the things that people think are protecting them. So if somebody has a fear that they're going to choke and be unable to swallow, they might be in the habit of carrying a water bottle with them all the time. If they have that water bottle with them all the time, they think they were protected. And if they believe they were protected, that still means there's danger. So we want to remove those protections. And medication is a big protection for a lot of people. Many people, here's how a lot of people in the United States take their medications. They carry them with them everywhere they
Yeah.
go. They don't even swallow them. They just keep them in their pocket or their purse. And it's a form of reassurance. So that's a big disadvantage of the medication. It seems to be protecting you, and if you believe you are protected, then you believe that you're in danger. So that should be treatment of the last choice rather than first choice.
I am proud to say that from the culture that we come, we start yoga, teaching yoga to kids as early as in the first grade, like you mentioned.
Mhm.
We believe more in mindfulness. We've always believed in that. So are you saying that in such cases, a person first needs to do multiple sessions of therapy, and then, yes, the last resort is medication, if at all he's not able to pull himself up?
Yes. Yeah, I would much rather see people start with mindfulness, with exposure therapy, with the CBT work, and only if they can't get the results they want after a reasonable period of time, consider medication. Many of the clients I see here in the States, they come to me already on medication.
Yeah.
And so then I'm going to ask them, well, you're on medication. Why are you coming to me? That's because the medication's not doing what I want. And we have to look at that and help them back off the medication.
Yeah. I think we've covered a lot. Thank you so much, sir. It was really, really educative, the session. I think you gave us a lot of useful tips. I would request the audience to go out to sir's website, look at the books that he has, look at this, the self-help book that he's published. Also, a lot of exercises that you mentioned. Specifically, I want to mention some of the humor songs, sir.
Yes, yeah.
Yeah.
I have on the website some songs that I've sung myself in a terrible voice about panic and anxiety. I like to have people find humorous ways to respond to the anxiety. It helps them kind of become more aware of just what they're up against. This isn't a fight. This isn't a threat. I'm getting fooled by my own thoughts here, and there's something funny about that. And so I have funny songs on there. I encourage people to do things like make poems out of their worry content, to make a haiku or a limerick, all kinds of ways of working with the fears, of humoring the fears, rather than opposing and running away and fighting them and treating them like a threat. It's not a threat, it's a trick. And then you try singing or even just listening to me sing some of those songs, see what happens to your anxiety level.
I think I'm going to end with that. It's not a threat, it's a trick. So, try to take effective measures, especially therapy. Look up self-help material that's been online. Thank you, sir, so much for being here with us.
Oh, thanks for having me. I enjoyed doing it.
If you or anyone you know is looking to seek help, you can reach out to us.